I think the first and obvious question is your reaction to the passage of this monumental legislation. What is your reaction?
Well, I'm really so thrilled for the American people. That was a real victory last night for small business owners and families and people who have really struggled not knowing if they'll have the security of health insurance next week or next month. And this is a huge step forward, and Congress took a big step for all of America.
Who wins in this? In the end, there's been so much banter, especially on talk radio, about the winners, the losers, depending on your perspective, which side of the spectrum. Who's the winner here?
Well, I think, as I said, the American people are the real winner. Small business owners, the engine of our economy, will have a new marketplace and some choice and competition. Families who have a child with a pre-existing condition are going to be able to get that child covered with insurance, and they're going to have some negotiating room. People with insurance that they like will see their costs come down because we're going to change the rules and make sure there's some control over how much overhead insurance companies can charge, make sure they use the majority of the premiums to pay for benefits. Seniors will see Medicare strengthen. So really, American people at every age group are going to benefit from cracking down on insurance companies, making sure we have a system that works for everybody.
Reuters put together a fact box on this, and they did a spread of what the winners were and what the losers were. They said that brand name drug makers, biologic drug makers, device makers, and hospitals are the winners, and the losers are the health insurers. Generic drug makers are the losers here. Any qualm with that? Any argument with that breakout?
Well, I haven't seen the Reuters study. The savings out of the health system from hospitals and device makers and brand name drug makers were really discussed during the course of the plan. What we don't want to do is hurt the benefits that seniors rely on, but we want to drive higher quality care in hospitals across the country, and I think that's good news for everyone. I do think that seniors will see a lowering of their drug costs, and that, again, is helpful and is beneficial. And, you know, we had a system that was unsustainable, breaking budgets, breaking government budgets, family budgets, business budgets, and this is such a new framework for America. It's something we've talked about doing for decades, and we finally are making steps in the right direction.
One of the things on the streets here in our area, and I assume across the country, is the misinformation about what's going on here, even down to the simple notion of government oversight of insurance versus a government-run program. How can you correct that?
Well, we're going to have to be out very aggressively with members of Congress and others around the country to talk about what is really in the plan and what really has been part of the intentional misinformation. This is hardly a government takeover. It's a private market structure. And as you know, you had some members in your area who really thought we didn't go far enough in terms of government really running the insurance plans for folks. But the president felt it was important to build on the current system. So small business owners begin to get a break right away, some tax breaks to come back into the market, but there is no government takeover. This will be a private market strategy, and we'll be laying out for people over the next couple of months what exactly happens, what the timetable is, and what the benefits are, whether you're a senior or a small business owner or a family. And there's some good news for everybody.
And I know we have a very limited time. We very much appreciate it. Last question. How monumental for you and for this administration? How big of a deal is this?
Well, on a personal basis, this is kind of a very significant step forward. You know, my dad, the former governor of Ohio, was in Congress when Medicare was passed 45 years ago. He was a member of the committee that helped to write it. Today is his 89th birthday. He's a grateful Medicare recipient, and to be now in this place with this president who made a commitment while he ran for office that this was his #1 priority, and to be here and watch the members of the House of Representatives 45 years later have the biggest tax break for Americans for health care in the last 45 years, the most significant change, is really pretty historic and good news for America.
Well, thank you so much for joining us, and thank you for taking the time. Happy birthday to your dad.
Thanks.